Cynthia Brown, an associate professor of clinical medicine at Indiana University School of Medicine in the Division of Pulmonary Allergy, Critical Care, and Sleep Medicine. And I'm going to be talking today about restless leg syndrome. And for any of you who experience this, you know that when your restless leg syndrome is acting up, you are walking all night and you feel like a zombie. And I'm going to start with the patient's perspective. It can be any variety of sensations that sometimes is hard to be able to describe. So some things that might be described as, so imagine dragging a stiff bristled hairbrush across the sole of your foot over and over for 6 to 8 hours. Now imagine that same sensation inside your legs. It's like having wasps in your leg bones, stinging and stinging. It may sound insane to someone without restless legs, but I fantasize about chopping my legs off. And I am also a restless leg syndrome person. I suffer from this. And when I lie down in bed at night, it's like there's something underneath the skin in my legs, particularly in my calves, like there's a bug crawling around inside my body. And the sensations build, and then my legs pulse and tingle. And if I don't move my legs, they will jump and move all on their own. So I know what it's like to live with restless leg syndrome, and hope I can help educate a little bit about this today. So I'm going to discuss what is and is not restless leg syndrome, or RLS, which is what I will call it through most of the presentation. I'll discuss some of the symptoms, some predisposing conditions to discuss with your doctor about if you're suffering from this, and talk about the phenomenon of leg movements during sleep and how that overlaps but is not quite restless leg syndrome. We'll talk about how restless leg syndrome is treated and what to do if your meds are not working like they used to do. So what is RLS? RLS is a common condition. It affects up to 15% of people worldwide and tends to be more common in people of Caucasian ancestry. It is really marked by this irresistible urge to move the legs associated with some sensory symptoms. Many patients find it hard to describe those sensations, whether it's a creepy, crawly sensation or this sense of nervous feet or shocks. It's not always painful. In fact, it's unlikely to be painful unless you're trying to ignore that urge to move, at which point the pain tends to build and build. The diagnostic criteria for restless legs includes the following 4 things identified by the urge mnemonic. So you need to have an urge to move your legs that is accompanied by an unpleasant sensation. It gets worse when you rest, and it gets better with movement. And the symptoms start typically in the evening and get worse over the course of the evening. Some risk factors associated with restless leg syndrome: it tends to be worse as individuals age, women of female gender, and there is a family predisposition, although the exact genetic marker is unknown. It is worse in pregnancy, typically in the 3rd trimester, and a variety of medications can cause this. I've listed a few of the big drug types that cause this, but if you have symptoms, you should talk to your pharmacist or physician to find out if there's any medications that could be doing this. Some of the common antidepressants that might cause worsening of restless leg syndrome are the SSRIs. That would include things like Zoloft or Prozac, some of the nausea medications like Phenergan, and some of the antihistamines like Benadryl. So be cautious when taking these medications if you're suffering from restless legs. One thing that almost every physician will screen for in an individual with a new diagnosis of restless legs is iron deficiency, because as iron is replaced, the symptoms can get better. Other common conditions that are associated with restless legs include kidney disease, particularly individuals on hemodialysis, patients with neuropathies and spinal cord injury and spinal cord disease, including things like lumbago and low back pain. And then people who have chronic venous stasis, which is a condition associated with prolonged edema and swelling in the legs, where the skin becomes thickened and discolored. What is not restless leg syndrome? Well, periodic limb movements during sleep is not restless leg syndrome. As stated, RLS is diagnosed based on symptoms, the urge symptoms. As a reminder, that's the urge to move, resting makes it worse, getting up to move makes it better, and it's worse in the evening. So it's based on those symptoms and not what happens when you sleep. However, most patients with restless leg syndrome will kick their legs during sleep. So if an individual with RLS undergoes a sleep study, periodic limb movements will most often be seen, at least in 80% of the cases. And your bed partners may complain about you moving your legs at night if you have restless leg syndrome. I know on my side of the bed, the sheets are thinner because I move my legs back and forth a lot at night. I call it my cricket legs. But you can kick your legs at night and not have restless leg syndrome. So many people who have periodic limb movements of sleep or periodic limb movement disorder do not have restless legs. So if you have a sleep study and a doctor tells you that you have RLS based on that and not based on your symptoms, that is not a true statement. You have to have some symptoms in order to be diagnosed with restless leg syndrome. So I wanted to just briefly talk about this periodic limb movement disorder, because this is a sleep disorder that is diagnosed when a person is seen to kick their legs during sleep, but does not have any symptoms of RLS, but has some daytime consequences. And the leg movements may be small. You may not even know you're doing it. It could be something as simple as flexing your big toe during sleep, or it can be a large movement and flexion of the entire leg. So we can say someone has a periodic limb movement disorder if there are leg movements from sleep that are causing sleep disruption and arousal from sleep. If there are daytime consequences, such as fatigue and excessive sleepiness, and if other sleep disorders, including sleep apnea, have been ruled out or treated. So you can't just label somebody with restless legs based on limb movements, and the presence of limb movements is in and of itself is not a sleep disorder. Restless leg syndrome can be treated in a variety of manners. First, I want to talk about the non-drug therapies. People with RLS often note that during times of quiescence, for instance, sitting on a plane or going on a long car trip, they'll notice the symptoms. At these times, using things like mentally alerting activities will help. So reading a book, playing a computer game, working a crossword puzzle, doing crafts, those types of things will distract your brain from the presence of the restless leg symptoms. Of course, that doesn't work when you're trying to sleep at night. And that's often the time that people really become very aware of their RLS symptoms. Things that are good practice to prevent worsening of RLS symptoms are avoiding sleep deprivation and decreasing caffeine intake. Mild to moderate daily exercise definitely can improve restless leg syndrome, although when you first start an exercise program, that can make it worse. And when the symptoms hit, what do? People get up and walk. I've had nights of pacing or rubbing your legs just with a massager. That can help. Lots of people enjoy soaking in a hot bath to try to decrease the intensity of the symptoms, or using stretching or yoga maneuvers. What about specific devices that might be marketed for restless legs? Well, there's no strong clinical evidence that any of these help. And what type of devices am I referencing? Well, you may have seen things like this if you've ever been in the hospital. We call them SCDs, or spontaneous compression devices. They do market units for this, like this, for home use for things like restless leg syndrome. They have not definitively been shown to be of clinical benefit. And this on the right was a device known as Relaxis that was marketed for restless legs. It had a vibration and a heating to apply under the legs at night. And it did at one point have an FDA indication, but because it never was able to be covered as a device, the company has now stopped marketing it. When looking at medication categories for restless legs, they fall in a dopamine type category. So levodopa or levodopa-carbidopa, which is Sinemet. Dopamine agonist like pramipexole or Mirapex, or ropinirole, also known as Requip. Those are commonly used and they're quite effective. The other big category that is really commonly used are the alpha-2 delta calcium channel agonist. Many people will know these medications and will have used them for other indications, including acute pain and neuropathy. And those are medications such as gabapentin, known as Neurontin, and when marketed as an extended release formulation for restless legs, goes by the brand name Horizon. And then there's pregabalin or Lyrica. Rarely, benzodiazepines such as clonazepam can be used, but it's typically only useful for people with intermittent symptoms. Here is a treatment algorithm that is commonly used in restless leg syndrome, with the first step being to screen for iron deficiency. And if iron deficiency is present, treating with oral or IV iron, depending upon the severity of the symptoms and the severity of the deficiency. And once that has been treated, then to reassess where the symptoms are after increasing the iron levels to appropriate values. If, of course, there are continuous symptoms, then the patient would go into the treatment the other pathway of the treatment algorithm. At that point, you want to assess whether somebody is just having problems here or there, some intermittent symptoms, or do the symptoms impact an individual on a daily basis. If the symptoms are intermittent, levodopa can be used, although it's been often replaced by some of the other dopamine agonists like Mirapex or Requip. And this is where benzodiazepines are sometimes used. Of course, all providers tend to be a bit cautious because these have some addictive potential. For daily treatment, usually a dopamine agonist, gabapentin, or pregabalin are used. For individuals who are worse on therapy, you may come in and notice, I'm already on treatment, not with one, but two therapies. What should I be concerned about? Well, there is a phenomenon called augmentation that can occur in people treated for RLS. And it can be worse, particularly if levodopa is used on a daily basis, but can occur with some of the other dopamine agents. And augmentation is when the symptoms really start to get markedly worse despite good therapy for the disease. And some of the things a patient with augmentation will tell you is that the symptoms occur earlier in the day. They begin to affect the arms. They're more painful and more intense, and the medications do not work as well. So if there's any suspicion of augmentation of symptoms, then you really need to seek a sleep or neurology specialist to help, because many things need to be considered, some of which is to go back to the first step in the pathway and look at things like iron deficiency or other medications that might be contributing. If there's nothing else, then you have to decrease the dose rather than increase the dose, or change a dosing schedule where you split the dose in half and give it at 2 different times. And then you might even have to switch to another class of drugs. So I want to conclude here and just reiterate that restless leg is a common disorder associated with increasing age and a variety of medical comorbidities. Its symptoms, and it's the urge symptoms that are used to diagnose restless leg syndrome. Leg movements during sleep are common, but not everyone with leg movements has RLS. Symptoms are required for diagnosis. You want to treat iron deficiency and other risk factors, and then evaluate whether your symptoms are daily or intermittent before going down a treatment pathway. And anybody with worsening symptoms on therapy should be evaluated for augmentation. Thank you very much for listening to my talk today on restless leg syndrome. I appreciate your time.